Hello, my name is Gloria Macias. My topic is on heavy DOCK2 deficiency in patients with early-onset invasive infection. Definition. It is a rare primary combination T and B cell immunodeficiency characterized by invasive and recurrent early-onset viral and bacterial infection associated with immunopopeia and functional T and B cell defect. For antibody response and thrombocytopenia, depending on the type of infection agent. The various clinical manifestations, including many recurrent pneumonia, bronchiolitis, otitis media, meningoencephalitis, and colitis.
Hello everyone, and thank you for viewing my presentation today on inherited bone marrow failure, genetic testing, and advantages of early diagnosis. My disclosures: I am a molecular geneticist at Prevention Genetics. My name is Michael Chica. I've been a molecular geneticist at Prevention Genetics for over 10 years. I specialize in developing genetic tests for blood disorders. I've signed out many reports for patients with different hematologic conditions, and I've probably communicated directly with some of you regarding your patients. Here, we are looking at a list of common blood disorders for which we test. We are also looking at an electron micrograph of a red blood cell, a platelet, and a white blood cell, three main cell or cell-like entities found in blood. When red blood cells, neutrophils, or platelets are not functioning properly, or their concentrations in blood are too high or too low, patients may experience symptoms of different blood conditions, such as von Willebrand disease, thrombocytopenias, neutropenias, or anemias. These symptoms may be an indication of a broader condition involving bone marrow failure or a hematologic malignancy. There are several main objectives on which I will focus during this talk. I will first define inherited bone marrow failure syndrome, and then discuss genetic causes of inherited.
Application in nursing. The application of polymorphism are numerous both in a basic research and in clinical application. The comparison with DNA from various biological remarks, such as blood, stem, and saliva. Last rates there are used for clinical support, such as the identification of biopsy, the possibility of transplant, the genetic instability of tumor, etc. They can also be used medical for the detection of susceptibility to pathogenic process, especially in the prevention of complex disease.
The early 1970s were heady days for American doctors. Important advances in medical technology, from the iron lung to the artificial heart, had made it seem that anything was possible. At the forefront of medical innovation was the Texas Medical Center.
Below me, a delicate operation is taking place, an operation on the human heart. The surgeon is...
The center carried out the world's first successful heart transplant and was pioneering the separation of conjoined twins. Houston was starting to build a reputation for clinical excellence.
Houston still had a bit of the flavor of the Old West. If you are man enough to do it, you can do it in Houston. And that boiled over to the medical center that we had a can-do attitude, and we're going to do it.
By 1971, we in the United States were well along in a remarkable period of medical progress. Medicine was on a roll, and in that climate, it was natural for physicians and researchers to want to take up any condition which was incurable and treat it as a challenge.
First, there are studies in the case in a group of children that normalization of teeth, cell function, and clinical improvement. Result we identified violet mutation, the cytogenesis genetic DOCK2. Cons. There are studies carried out in which two patients died in infancy. after allogenic hematopoietic stem cell transplantation. In some cases, there are chronic complications.
So looking at the immune system and dysfunctions, I'll talk a little bit about the deficiencies that can happen. So an immunodeficiency can either be primary or congenital, and of those that includes your B lymphocyte deficiencies, or you can have a T lymphocyte deficiencies. There can be combined deficiencies, which is a B cell and T cells. There can be complement deficiencies, or there can be problems with the phagocytes. There can be secondary immunodeficiencies, and generally they are medically induced, meaning that a person has another condition that's causing the immune system not to work properly. So it could be, say, cancer, a leukemia, or it could be medications such as an immunosuppressant therapy that would cause a deficiency in the immune system. And of course, then there is HIV/AIDS that is considered a secondary immunodeficiency as well. Primary is often congenital, where a child is born with a problem in the way the body builds either B cells or T cells or both. And so it's diagnosed often in infancy or in childhood, because kids are the ones that are the cesspools. They are exposed to more, as well as their immune system, if it's not working right, would have recurrence of diseases. So this deficiency would be recurrent severe infections. So generally preschool kids or school age kids have between 6 to 12 infections a year. Adults, you'd see more like 2 to 4 infections a year. And most of these infections aren't severe, but if someone has a primary or congenital immunodeficiency, you'll see that they have.
This is a play in Ecuador. The Ecuadorian National Registry of Chromosomal Alteration and Polymorphism provides a baseline sub-data under their chromosomal anomalies in Ecuador, and therefore their clinical management and outwards. This date with wide public policies maker to promote and financially support cytogenetic and genetic testing.
One of the disease categories that we are very interested in is called severe combined immune deficiency, which is really a variety of disorders. Easily up to 20 different genetic defects could lead to this disorder, but it is what the bubble boy had way back 20-some years ago, and it leads to a profound vulnerability to infections. These children would all die by age 1 to 2 years typically, with rare exceptions, and with our reduced intensity therapy, we are able to offer transplantation from a wide variety of sources. Different options and technologies are readily available.
Conclusion: autosomal recessive DOCK2 deficient is a new Mendelian disorder with pleiotropic defects of hematopoietic and non-hematopoietic immunity. Children with clinical features of combined immunodeficiency, especially early-onset invasive infection, may have this condition.
Like any rather complicated machine, and the immune system consists of quite a lot of different cells and molecules, and they have to interact in various ways, things can go wrong sometimes in the immune response, and you can end up with immunodeficiency, a deficient immune response. Sometimes this is due to external agents, and in that case we refer to secondary immunodeficiency. But now we're going to discuss primary immunodeficiency. So primary immunodeficiency is defective immunity that is due to either an inherited or an acquired gene defect. The distribution of cellular primary immunodeficiency defects is that around about half of them are caused by defects in B cells and therefore in antibody production. A little bit of background about primary immunodeficiency. Most primary immunodeficiencies are caused by an inherited gene defect, although, as already mentioned, some are due to spontaneous mutations.
Thank you.